אני חושב על הזמן, איך ביחד איתך לא אכפת לי לאן. בואי נגור במושב ונבנה לנו בית קטן, אני ואת. אני חושב על עתיד, מאז שנפגשנו ידעתי איתך לתמיד. אני זכיתי בלוטו, איתך אי אפשר להפסיד, אני ואת. את כזאת שאוהבת שמיים, הפרסום לא עושה לך עיניים, כסף הוא בא והולך את אומרת תמיד. את אוהבת אותי אמיתי, לא על במה במיטה כאן איתי, אני שר לך.
Good afternoon, everyone.
Good afternoon.
We're here this afternoon with, I'm Bat-Sheva, and this
I'm
is
Ilana.
And I have a special guest here, Dr.
Katz.
Dr. Katz. My name, I'm like, Dr. David L Katz. He's a Chinese...
a doctor of Oriental medicine.
Doctor of Oriental medicine, to be more precise. And it's an honor, you know, one of I consider myself very close to that area, to Chinese, to the Chinese medicine, to homeopathy, and basically all the alternative medicine, if we can call it. We brought you here, we're talking about a doctor that has over 30 years of experience. Semi-retired already. We brought him. We schlepped him from the.
You dragged him out of
the
retirement
and brought him here to talk about medicine. I don't know how he can handle it. No,
I love it. I love it.
I'm sure he could. Yeah. I mean, I know that you have clients. I mean, I don't know as much how many, a lot now, but I know you have clients from all over. It's not just local people from Chicago.
I've had patients come to me who have had a problem for years and years, tried many different things, and I was able to help them. So I've had people that have come to me from Chicago, from Miami.
No, that's amazing. So they actually came, or you treated them over the phone?
No. They actually came. They came out here, and at least that's how we initially work. But some people will come out here and they have a regular every 3 months, every 6 months. Mm-hmm. I don't think that's the best way to treat, but they're obviously getting some result,
right?
Because they keep coming back.
And I know that you specifically mentioned functional medicine. So yes. I want you to elaborate more about what do you consider it's functional medicine?
Well, my background is in Chinese medicine,
right,
and acupuncture, but I've been in practice for over 30 years, and my practice has evolved into what I call functional medicine.
Right.
And basically, I'm using whatever somebody comes in with is a dysfunction.
Right.
Okay, so if somebody isn't functioning at an optimal level, they have a symptom. Now, obviously, you can treat the symptom. You get a headache, you can take an aspirin. But what I'm attempt to do is find the underlying cause.
Right.
I say functional medicine because I'm not restricting myself to Chinese medicine. I use homeopathy, clinical nutrition, supplementing, and basically I'll do things that are not quite Chinese medicine, but they've been very effective,
right,
and things I've learned over the years.
So, for example, are you referring to like also Ayurvedic?
Not Ayurvedic, homeopathy.
Homeopathy, as you mentioned.
See, the way the body works is like stimulus response.
Okay.
It's hot, the pores open. Mm-hmm. Right? But due to certain circumstances, things start happening or stop happening. We call those things symptoms.
Right.
So I have a testing procedure whereby I have dozens of tissue samples, pathogen samples, food samples, environmental samples. What I try to do is find the stressors that are not allowing the body to adjust. And if it's not adjusting, you eventually create symptoms.
Oh, are you referring to, because I went to a doctor like that in Tarzana, where we had those little sample, but it was called, because he would like touch the people and touch the...
Something like that. It's called neuromuscular circuit testing.
Right.
Yes, so, it's kinesiology or muscle testing.
No. Kinesiology is something. No, I'm
Yes,
familiar with.
kinesiology is something else.
Yeah, no. He had also like this little suitcase with like weird little thing there.
Yeah,
that you can
I've got a whole bunch of those weird
Yeah,
little
so
things.
he would touch you, he would touch that, and then back and forth until he figure out that would be the cause. Or so.
The underlying stressors, yes. Like I say, what I first do is attempt to find the most stressed or weakest organ or system in the body.
Mm-hmm.
What kind of toxins or other things, and microbial or other things that are
Right.
stressing the body.
Mm-hmm.
So this
And how do you do that, Dr. Katz? How do you find that?
through this testing process called neuromuscular circuit testing. So what I'm looking at it initially from a Chinese medical perspective,
Mm-hmm.
but the stressors are caused by something other than emotional, and then I can test for viruses or bacterias.
Is it a blood work?
Toxic
By blood work?
No,
No,
through
no.
a muscle test.
You can test them bacterial through muscle tests?
I
Muscle testing
can.
is a
I
special
can.
technique. It's
Now, I used to, many years ago, would be specific as far as viruses or bacteria. And I would test, and they say, well, you have vesiculosis northwest virus, Mrs. Jones. But then the internet came on, and people look it up, and they think they're going to die. So it wasn't that important. I was just trying to sound more medical.
Okay.
But that's what I'm looking for. Number one is what the stressor is, food allergies, virus, whatever, and then the level. On a scale of 1 to 55, 55 being the highest, the idea is to bring it down through either detoxification or support
Mm-hmm.
until we get the body in balance. The symptom will clear.
Okay, so when you go, for example, so when you detect the problem, and when you say that you're going through detoxification, so you you prescribe, you give them herbals, medicine, and things like that, that also you attack it also from the nutritional side?
Look, in Chinese medicine, everything has to do with circulation. And good circulation is health. Poor circulation, or what they call stagnation,
Right.
produces discomfort, pain, and then the longer it is, the more and more physical it becomes. Stagnation can be caused by excess or deficiency.
Mm-hmm.
Stagnation by excess is like a dam holding back the water. It's viruses, bacteria, toxins, and in that case, you want to detoxify.
Mm-hmm.
But stagnation could be caused by a deficiency, constitutional weakness, genetic deficiency, chronic illnesses. And in that case, you want to support the systems.
Right.
So the whole idea is to promote circulation. Optimal circulation is optimal function.
And the way, one of the ways that you promote circulation would be with acupuncture?
Yeah, I don't, personally, I don't use acupuncture that much anymore.
Okay. So,
And what I've been using for the past several years have been magnets on the acupuncture points. And I found that I was doing, I used to use just magnets for children and people who are needle phobic.
but were there specific magnets?
No, there's like a 900 gauze, but you put the acupuncture, you find the polarity of the acupuncture point, and you tape a magnet on there for X period of time.
So it was working equally as if you would do the needles themselves?
I find in some people feel that the magnets are too strong.
Oh, wow.
Other
Why? How
people-
would they feel it?
The energy.
They're little like nervous. They've
They
got
become
nervous
nervous?
energy.
Okay.
On the other hand, I've had people say they've never slept so good in their life using the magnet. So,
No, that would be,
and the thing is, I get a lot less resistance. People,
a phobia
for
the
whatever
needles.
reason,
Yeah, I know.
Dr. Katz, you mentioned earlier that that circulation is one of the major things that causes dysfunction and stagnation.
Yeah.
How do you know? Obviously, you're very experienced in this. But looking at a person, you can right away tell by a person's color of the skin or posture or complaint that you will say this is a circular situation.
No, everything has to do with circulation.
Everything.
Period. If there's good circulation, there's health. If there's poor circulation, you start getting stressors. whether this, it could be the liver, it could be the lymphatics, it could be the spleens. Eventually, you're going to get diabetes, heart disease. That's way
Right.
up there.
That's when
Down the
it's
line,
already
That's the
degenerating.
progression.
Okay.
But
You know?
she's saying like what would be the first signs, you mean?
Yeah, what people complain when they come to you and say, I have, what are the symptoms of poor circulation?
No. The
No.
people don't come in here and they say, I have poor circulation. They come in here, they say, I've got gynecological problems. I've got allergies. I've got respiratory problems. I have migraines. And so the idea is to find the underlying causes, the stressors.
What do you say to the people that say everything is digestive? Because there's a whole school of thought that says everything is in digestion.
I agree.
Agree.
Listen, good health, good digestion is the basis of health.
Right.
If you're not eating well or you're not absorbing or assimilating, your body is not going to.
They say also that our immune system is sitting in our guts.
Oh yes. They say. In fact, there's a whole area of Western medicine called gastroenterology, where they're saying they call the gut the second brain, because how you digest or indigest, of course, it affects your energy and your sleep. It also affects you on an emotional level, and then you'll get that information to the first brain and say, "Oh, I'm depressed," or something like that.
Right, because you feel off.
So there's 4 levels of health here. So there's crisis intervention, which I'm not dealing with. That's a broken leg, whatever.
Okay.
Then there's the relief stage, and that's usually done through detoxification or support. Okay. Then we get into the support and correction, and this is where you tweak the body so that you optimal function is relative. All right. Optimal function for me is not going to be the same for an 18-year-old.
Okay.
How we determine optimal function is consistency. Because people, if they have symptoms, that's where they're focused on. If they don't have symptoms, they're not focused on that, and the consistency is. I'm not saying they're never going to get a cold, but ideally, the ideal is an abundance of physical and mental energy with a general feeling of well-being. That's the goal.
There's also a lot of people, and it's sad and scary in a way. They live with chronic pain for the longest time, and they don't address it. They let it sit there for like.
Well, I'm just getting old, or you learn to live with it. There's a lot of reasons not to do something.
But they say things could be worse.
Or things could be worse. And that's what I there are people that minimize it. And they say, well, I'm not too bad. This guy is worse. Well, what about that guy? Better?
Exactly.
But so when I'm mentioning this, I was trying to get to like the fact that are you also giving people the prevention methods?
Well, the fourth level of healthcare is maintenance.
Right.
So that whole idea is to sustain that level of function.
Yeah.
And whether that's, some people I've seen for years and years, I see them once or twice a year.
Oh, that's
just
amazing.
to maintain their level of function.
So that's what I'm saying. So even if someone who came to you originally for a problem and you managed to to solve it in a way, you still recommend them to keep like a maintenance thing, like you do with your car and anything.
Yeah, exactly. I mean, it's like you say, your car is not going to. We get older. Unfortunately, everybody has weak areas, and those weak areas start showing up, and that's where you start getting your cholesterol or your diabetes or whatever it is over time.
The first signs, right?
Yeah. So the first thing you may get is digestive problems, and then it goes into other things, or maybe the digestion could affect a musculature, and so you can work on the muscles all you want, but it's an internal.
Right.
It's a reflex.
So you have to pay attention.
Yeah. And so what happens? I'll have people that I've worked with for years, and they start feeling bad. I've introduced them to herbal formulas, and they'll take the formulas. They'll just come in and buy the formula. And if that doesn't work, they're not getting results, then they come in and see me. But like I have a whole list of of herbs that you can find in your kitchen.
Yeah, so that's the one thing, because you mentioned herbs. So first of all, I wanted to ask if so the herbs that you give to people, it's the herbs that you can find in the kitchen that you can
No,
cook.
the herbs that I give to people are Chinese herbs.
So yeah,
The
you didn't formulate any herbs of your own, basically, as far as like medicinal herb. You didn't.
Do you cook your own herbs? Is that what you're asking?
Not anymore. Not anymore.
used to?
Listen, when I first started, I had a pharmacy, and I would mix my own herbs.
Right.
But after a while, you spend 8 hours a day in the office, and then you come home. Maybe you have a glass of wine and try to do these formulas. You're up till 3 o'clock in the morning.
The reason I ask is a lot of,
Some of the glass
Chinese-
of wine may spill into the formulas.
Yeah.
Yeah.
But so, and also, the company that I get the herbs from can also package the herbs in capsules, and a lot of people
prefer that.
prefer the
That's
capsules.
easier.
Because the herbs tend to be very bitter, so a lot
Yeah.
of people I know they don't like the taste.
Dr.
of
Katz, why do doctors hate herbalists and homeopaths and why?
You know, I don't know that. You know, that's a whole. There are some
I do.
doctors.
My mom is a doctor, and
She's-
and that's the statement.
I've had doctors
Yeah.
say, you know, I had a patient who came in here was coughing blood. She had tuberculosis as a child,
Wow.
and she came in and she was coughing blood. I was treating her. She went to her doctor. He says, "Don't waste your money." So 6-7 months later, she goes back to the doctor, and her health is a lot better. He says, "Well, at least it's not hurting you." You know.
Yeah.
So the thing is, there are doctors that say, "Look, I don't know what that's about. If it's helping you, fine." And in fact, Cleveland Clinic, I don't know if you're familiar with them. They're like Kaiser in the Midwest.
Uh-huh.
They have an herbal pharmacy. They'll prescribe herbs or send a patient for herbs. If someone has a mild level of a bacterial infection, to use an antibiotic is really counterproductive, because then you become more and more resistant to it. Herbs are
We'll get that done.
and the body doesn't grow resistant, because here's the thing. You're familiar with valerian root.
Yes,
assume.
of course.
You ever hear of Valium?
Yes,
Valium is valerian root.
yes.
Okay. The difference is that the chemist finds the active component, makes it synthetic, and you get a real strong effect. You get the side effects that you don't get with the herbs, which aren't as powerful. But essentially, they're the same thing.
Right.
And also, I found, obviously, I'm not a doctor, but I've been treating myself for years and years with homeopathic remedies that I have a lot of books that I open and all that.
Yes.
And even my kids, as they were growing, I would go to they would call it my little Bible, and it's all ripped already, because my oldest son, thank God, is 31 now. He goes like, "I can't believe you still have that book. It's missing like the covers and everything." But what I'm saying is that you have to be so accurate with the
Diagnosis?
description of whatever
yes.
the problem is, because there's so many different one. Like if one
Things
of
are
them has
similar.
the cough,
It's very
but
similar.
not this, and one of them this.
Yeah.
So it's amazing, and it's not like so general as when you go to. And I'm not trying to take the place of the Western medicine at all. I mean, they have their
They have their place.
Yeah,
yes.
they have their place, and they studied for it. But what I'm saying is there is so much more than that you can.
Well, look, the United States promotes Western medicine. I mean, it's a big business. Healthcare is a big business. In 1850, the American Medical Association was formed to suppress homeopathy.
Oh.
That was their basic thing. Then they went after naturopathy, and those naturopaths sort of came into the fold of Western medicine. And then they went after chiropractors. Now, the chiropractors in the 50s sued the AMA for restraint of trade, and they won.
AMA stands.
American Medical Association.
Oh, okay.
But they're accepting of it now. I mean, acupuncture
More so.
is paid by the insurance,
Yeah.
and some massage
For
therapies
pain, yes.
For pain.
For pain. that
Not for
they don't
preventive,
pay for
yeah.
what I would do, which is internal medicine. And so, whereas someone would come to me for, like I said, gynecological, respiratory, digestive, allergies, migraines, if I were to put that on an insurance thing, they would not accept
They wouldn't
it.
pay that.
Yeah.
But if you put its pain,
If I put, shoulder pain, we'll pay for that.
yeah,
You know?
exactly. So it's just a
Yeah.
matter of
They don't.
strategy.
Although,
But-
yeah,
But the acupuncture is becoming more and more.
yes.
Except,
Yes.
like in Kaiser, which has acupuncturists, but it's more in the area of physical medicine, of
Mhm.
physical therapy rather than internal medicine.
Like injuries, you mean?
Yes, like a physical therapist and acupuncture. That's how they classify.
Uh-huh. But what will be so what's the connection there? I mean, physical therapist is going to physical therapy, and so what the herbs for
Not the herbs; they just do acupuncture.
Oh, for the
They're
acupuncture.
different.
Okay.
Yeah,
You
they're
know,
not paying for the
no, no.
herbs.
Acupuncture is only one
No, I
modality.
forgot acupuncture, the needles you're talking about.
Yeah.
Yes.
There is a therapist in town. She's very popular by the community. Her name is Teresa Gormley. Have you heard of this
No,
lady?
I've
She's
never
in
heard
of her.
she's
No,
in
haven't heard
she's
of
in the
her
city. She also is a holistic chiropractor, but she uses something very different than what you're talking about. She uses she has energy.
Uh-huh.
She's doing the kinesiology.
Kinesiology.
How is this different than what you're doing?
You say she's working with energy. That's
She
something like qigong, or
Oh, probably not. But like what?
she would like knock on your head and will give you something to hold, and if you have strengths, then it's the right concussion for you. If it weakens you, it's the wrong concussion for you. And it just it's an interesting situation.
yeah, it's similar to what I do. I
Similar.
don't know exactly what she does, and there's
It's a
lot
German technique, I think.
Yeah, well, the process I use is a combination of the German electroacupuncture and the Japanese technique of bidigital.
Okay.
And so I don't knock people on the head, and I don't,
You don't do
poke
that.
people's arms,
Kinesiology, yeah.
but I'll use a finger, because I'll spend a half hour, 45 minutes going through samples and have somebody like this,
Yeah.
get tired.
That was the guy. I can't think of his name right now, but because I took a couple of my kids to him, and he was like going like this every second. In the beginning, the first time they sent me to him, because he's very known to he's in
Van
Tarzana.
Vensko?
He has I think he has like a Dutch name.
Van Vensko, yeah, I worked with him.
Then what's his name?
Matt
Yes,
Van
yes,
Vensko.
Dr. Matt. Yeah,
Yeah, he
Dr. Matt.
passed away a few years ago.
He's
But
young. He was young.
Yeah.
Oh my God!
When I worked with him, actually, when I got out of school, the first job
my
I had was
God.
with a chiropractor who was the chiropractor with a star. So I was doing a lot of acupuncture on wrinkles and smoking and stuff like that.
Oh,
And then I was introduced to Matt.
wait, that helps.
Yeah, it does.
Acupuncture helps with wrinkles?
Oh yeah.
It
Yeah.
does? Not
Okay,
There-
I'm
there-
in for
there-
it.
There are doctors that just do that.
Oh,
They just do that. I didn't want to just do that. And then I was offered I met Matt and
Wow,
worked
I'm
with him for
shocked
3
right
years.
now. Wow.
Yeah.
Because he saved, like, I knew him because he saved my friend's daughter. She had a history of ear infections, and she had the tubes, and she had the surgery, and he like changed her life. And when I had issues with my kids, she told me, you have to go to him. And the first time I went there, I'm like, oh my God, this guy's crazy. What's going on with him? He's weird. Okay, I don't know. And he was like doing this, and he's
Yeah.
touching that box and this and all that, like you said. And I'm like, okay. And he was oh, okay, thank you. We'll see you next time. And I'm like, I don't know. And I talked to my friend, and she goes like, you have to follow what he says.
Yeah. Well, if I see if somebody comes into me, I tell them if they can't agree to 4 treatments, don't waste your money. Because if somebody doesn't know what I'm doing and they come in with a headache and they leave and they still have a headache, they say, what am I coming here for? I can take an aspirin.
Right.
But this is a progressive, and certainly after 4 treatments, if someone is, I'm not saying I'm going to cure someone in 4 treatments that had something for God knows how long, but if they're not feeling change in 4 treatments, then maybe I'm missing the boat. I expect results.
Right, yes. I just want to mention, because we have some guests, and I want to mention that we have Dr. David Katz here, Oriental medicine doctor. So if any of you have a question to ask him regarding the different forms of medicine, in the Oriental medicine, they would be happy to answer the question. And also, we're going to get into the herbal cabinet medicine that you can make at home. But I just want to see who. So we have here Vula Giannapoulou.
Greece, just a shout out to Greece.
And Con Burliufas and Panos Christoforou and Dustin Starr joined us as well. I don't know if you have anyone here.
I'm not yet. I have a question, Dr. Katz.
Yes.
Eczema. Is eczema the same? I know in Western medicine, eczema is treated the same as psoriasis today. Steroids, and that's it.
Yeah.
Or maybe hormones.
Yeah.
Is what does Oriental medicine has to offer to eczema?
Again, the eczema is a symptom. So what Western medicine does is focus on the symptom. I'm focusing on the cause, and there may be a number of causes. Now, in Chinese medicine, eczema would be classified, the diagnosis would be damp heat accumulation. Basically, that's a liver dysfunction. And for instance, I don't know if you're familiar with Candida.
Yeah,
Candida.
Yes.
All right. So Candida is another manifestation of damp heat accumulation. Damp heat accumulation is the internal environment, which is a perfect environment for yeast to grow.
Yeah, the Candida is a bacteria for people who don't know what.
Yeast.
Yeah,
it's
an yeast bacteria.
And Western medical approach is to wipe out the fungus, which is fine, but you're leaving the internal environment
It's
the
still in
same,
the
so
liver.
it comes back.
So it's the way the liver processes.
It could be I mentioned the liver.
Right. Everything is a liver, isn't it?
No. Everything is not liver.
Oh, okay.
Everything is.
But everything gets
is everything.
processed
There's-
through liver.
Everything is everything.
There are 5 there's a liver, there's the heart, there's the major organs are the liver, the spleen, which in Western medicine is really more of a pancreatic function. The kidneys. So you have the major organs of the liver and the kidney and the minor organs of the gallbladder and the urinary bladder. And, there are thousands of pages, I guess.
So wait, so
What a condition.
eczema could be related to any of these organs, or it's specifically related to liver?
No, there's no specific, there. You look, listen, you go, there's some websites that you can go to that you mention the condition, and they'll give you a whole list of
I know, they're very
formulas.
scary.
The whole list of formulas.
Yes.
Because it could be caused by any number of things.
Okay.
And these formulas are,
But basically, he's saying that it's coming from the condition of warm. I mean,
the environment of the body. So
Things that you may eat for so many years that are,
Is it food?
possibly, I
Okay.
can't, it's not any one thing.
Yeah,
It could
right.
be an allergy reaction.
Okay.
But it could be, it could be a number of things. There's no, in Western medicine, there's a book called the Merck Manual. It has all the conditions,
Yeah.
all the diseases. You look up the disease, this is the way you treat it. Chinese medicine, you could have 3 different doctors with 3 different opinions, and they could all be right.
Okay.
Depends on how you want to address
So
it.
in your experience, such things as eczema and psoriasis, which is chronic diseases,
Yes,
are those can be eliminated, or they can be just handled?
it depends. Now, in homeopathy, they call eczema a miasm, which means it's a genetic condition. In that case, if you have a genetic condition, and maybe your parents or your grandparents have had that, that may not be so easily
Because
addressed.
they say that people that have eczema has to do with asthma. Asthma and eczema kind of on the same. If your parent has an asthma, your child might have an eczema, and vice versa.
Well, yeah, the skin, they consider it's called the third lung, because respiration is through the skin as well as through the lungs. So you can have a lung condition that can manifest on the skin. So allergies or asthma certainly can cause eczema, but not necessarily.
Yeah, or psoriasis.
Or psoriasis. Yeah. It can show up on, and a lung condition can show up on the skin.
And how are you able, by looking at a condition, you'll be able to see, or how would you know?
As I said, I do this test called neuromuscular circuit testing, where I have dozens of tissue samples, pathogen samples. Say somebody comes in with asthma. So first I look for the weakest or most stressed organ. Then I look at the area of complaint and see if there's any correlation, because it could be just the straw that broke the camel's back. All right. Then I look for some of the organs or systems that detoxify, which is the liver, which is the lymphatics. And then I'll look at how the body is functioning altogether. So most people have adrenal fatigue. Most people are in adrenal fatigue. So I could give them something to support the adrenals. But if there's something else going on that's stressing and suppressing the body's digestion, then you're not treating the underlying cause. So if I treat, what I would do first is to, like I said, either detoxify or support. Then we see whether we have to tweak the system.
And detoxify, there's so many definitions of detoxify. Yeah. But in your treatment, detoxify, does it mean starve a person?
No. I usually use homeopathic complexes to detoxify. Okay. For instance, if somebody has candida, I'll use herbs to promote a die-off of the candida, and they use homeopathy to stimulate the liver and the lymphatics to get the die-off out.
But then at the same time, would you advise this person not to touch sugar and yeast?
No, I do this test.
Okay.
There's this process called NAET. It's an allergy elimination technique. And so, whereas if I were treating candida conventionally, that person would have a whole list of foods they have to stay off of.
Okay.
And it's healthy.
Anyway.
They feel better, but after a while they feel deprived and resentful. I can clear up an allergy in 25 hours. So that's really impressive if you're allergic, if you know what you're allergic to.
Yeah.
And you're able to determine through testing what are you allergic to. And
Yes.
the same thing with migraines too.
Yes, the
Right.
migraine, again, the thing is to find the diagnosis is the
Right.
is
The
the
key.
thing.
Well, interesting with migraines is some people know what causes their migraine.
Still
For the
keep
most
doing
part,
it.
and they're in denial. And listen, if I have a glass of wine, I'm going to have a headache. That's my reaction. And I still have a
drink the
glass of
wine.
wine. Because
I want to go
Those
back.
were people.
10 minutes for fun.
Right.
I want to go
Yeah.
back because it's interesting. It's a close subject to me. I want to talk about remedies that you can concoct at home. That you can.
Yes, actually, so there are
Some of them I know you have a big
culinary,
list. Yeah.
like cinnamon, for instance.
Right.
Basil. Actually, if you want that sheet, I
Yes,
go into the whole
please.
thing.
So
You can either email you
okay, email
and
myself.
you
I'll
can give me
you-
that information, or just email me directly.
So let's give them the email for your email because maybe they'll have other questions. So what is the email? This is the camera. You can.
David Katz, OMD @gmail.com.
Not OMG.
No,
OMD.
Oriental Medical Doctor.
Yes.
One word. David Katz, OMD
at gmail.com.
@gmail.com, and
Yes.
I'll send you out that.
Please.
That's
Yes.
right. Okay.
So just let's touch a little bit about it because I know it's a big list. But you mentioned cinnamon.
I'm there. Like I said, cayenne.
Right.
There's just so many things that there's a whole list of things that can be. I'm trying to think now. I'm a little.
No, but let's say something right now, not to
Something practical for the
something-
winter,
Yes,
so
exactly for the
you know,
winter.
our-
Let's give our
audience
listeners
can,
something to-
Let's use cinnamon as an example.
Right.
Warm up your interior with cinnamon. Now, the cinnamon sticks you can buy in the supermarket are not the same cinnamon that you would buy in Chinatown. And
Right.
some said when I was in Taiwan, they had, you know, this. You see those cinnamon sticks?
Yeah.
Yeah.
Rolled up.
Yeah, this one was like an inch thick. You could smell it across the room. It's $1,200 an ounce.
Oh boy.
So it certainly has more of a.
Is that
potency.
what you use in your practice?
Yeah.
Okay.
Yes. I don't have the stick.
Yeah. but-
I'll write the formula to the company I deal with. They'll make the formula and encapsulate it.
What about ginger?
Ginger is very good for digestion. If you have indigestion or you have
I'm a ginger
stomach flu,
junkie.
you're a ginger junkie?
Ginger junkie.
But how much
Seriously.
ginger do you need? Because it's
I'm a ginger
what is the quantities? Because we all have like a little bit, and we scrape a little bit of. What is the right ginger amount? Is there a right amount?
I usually test for the right amount, but if you're the cinnamon, usually ginger, usually there's not Chinese formulas don't consist of one herb.
Right.
They, Western herbology, this herb for this, that herb for this. Cinnamon in Chinese medicine is it's called a harmonizer. It's in a lot of formulas, but it harmonizes the herbs. What you have in a Chinese formula is the king herb, which is the primary underlying cause, like liver qi stagnation or damp heat accumulation. And then so you have herb for that. Then you have herbs that are specific to the symptom. Then you have an herb that promotes digestion, and then you have an herb that harmonizes. I mean, that's a basic picture of a Chinese herbal formula.
Right.
Okay.
But back to our kitchen cabinet. You said some basil. You mentioned.
Yeah.
And anything.
I have to apologize to you.
Out of your
Because I don't use those herbs, and I'll pass out the form. But
All right, guys.
you know,
We'll get to
somebody-
the form.
What about onion? Is
very-
onion? It's not
it's
very.
very good, but
She's
I
a
wouldn't
junkie
kiss
of onion,
anybody.
of putting it on tables. She's like putting everywhere onion.
I'm an onion. Right now. I have to tell you.
And
Everybody's
last time
sick.
it was rotten and it was terrible. It came in waves and we
Well,
we
listen,
wanted to die.
I every winter everybody's sick around me, around
Uh-huh.
everyone, flu, virus, and everybody's doing flu shots, and I don't believe it. I mean, thank God, but I believe in onion. So everywhere I go, and I know if somebody's going to be sick, I place that onion in front of their face, because if they're going to sneeze, let them sneeze on that onion and not on me, because the onion has the magnetic field and the germs go into the onion, and it works.
Okay.
Yeah, I want to talk about actually the flu shots. What is your touch a little bit? I mean, it can be controversial, But,
I
Did you get a flu shot?
I have never gotten a flu shot.
There we go.
Just
I
a
rest my
moment.
case.
just
Just
a
a
moment,
moment.
just a
Just a
moment.
Okay.
moment. I have never had a flu shot until 2 years ago. I got married 3 years ago. 2 years ago, I got the flu, and my wife got the flu. It was so bad that she became dehydrated and
Oh, wow.
had to go to urgent
Hospital.
care.
Okay.
And so I took a flu shot to protect her.
Did you get the flu shot from her?
I didn't get the flu shot from her.
Did you
The
get the
flu.
flu from her?
No, I gave it to her.
Okay.
And I handle flus.
Your immune
People
system
come to
is
me
strong.
for colds and flus.
Right.
She got the flu and she wasn't able to kick it. And
So ever since then, you take the flu shot every year?
I took it last year.
That was the first time, actually,
Yes, that was the first time.
Wow.
And like I said, I did it
in order to protect her.
for my wife.
Okay,
I-
listen. When you I don't know. I I'm perplexed on that. I think
Yeah.
when your
But
immune
what do you
system
think
is
about it in
okay,
general? I mean, I understand that you have,
Yeah.
but what do you think about it in general? What's your opinion about it?
My opinion,
You're not
Well,
comfortable with that?
yeah, the thing is, it's, the big controversy with, vaccinations.
In general, yeah.
I don't know what to tell people. I do know that, all of a sudden we have a measles epidemic. It's hard. I can't. I don't know what to say about that. I mean, I don't want to give my opinion on.
That's fine.
You know,
I totally
I had
understand.
a
I totally
conversation. I'll
understand.
just comment briefly on that because we touched that. I had a conversation with a pharmacist who's going to be a guest here one day, and she said that all the immunizations that are not taken, that are being accused
Yeah.
for the disease, the behavioral diseases, autism and developmental diseases,
Yeah.
it's a hoax. There is no evidence out there that this causes autism or dysfunction or any kind of developmental issues in children. It's not no evidence whatsoever. What is happening is that there's this very famous movie star
Yeah.
who has, I mean, I'm not going to mention her name, but she's the one who started the whole immunization,
Anti-vaccination.
propaganda.
Yeah, I mean, it's
When I was
complicated.
in junior high school, there were 2 kids in my class that had polio, and you don't see polio anymore. So.
Right. Yeah.
So it's
Okay.
really is propaganda, and whoever is when you put him behind that, then that's where it's taken off.
Yeah. No, I mean, I understand. I don't want. No, I was talking mainly about. I was asking you about flu shots. I didn't want to go into this whole controversial. So
Look, I explained the reason I did it.
Right, no, I
took a flu
understand.
shot. I've never had a flu shot. I've never been sick for 3 weeks either.
yeah.
Thank
So
God.
I mean, I usually, as the first sign of something, I'll start taking some herbs, start pounding those herbs down, and
So you do take your own the herbs. You do treat yourself.
no,
with
I
herbs.
I have a whole list of drugs that I take.
I want to ask
You
you
know.
something. Is there like, what is your opinion about like supplement in general? Like I'm not talking about when there is a condition that you're lacking of something that you have to take. I'm talking about in general how people
Are they
it's a
all created
trend,
equal?
and they're all
No.
let's take this vitamin and this and that.
Yeah, listen, basic to health is good digestion. A lot of people either
Going
don't,
back to that again.
they don't eat enough onions.
The-
So supplements can supplement your diet.
Right.
However, there's a difference between food source supplements and synthetic fractious chemicals. So like when they first started breaking down foods, for instance, vitamin C, the active component of vitamin C was ascorbic acid. So you go to a lot of these stores, and they said vitamin C
Yeah.
in parentheses as ascorbic acid. So it's not vitamin C.
It's
You want a
what
good synthetic vitamin C, natural. Maybe they'll throw in an acerola cherry, and then they say it's natural. But a food source supplement, has the bioflavonoids, has the enzymes. And
But also,
it's like an herb as opposed to
Right.
valley.
What are like major companies of the good supplemental companies that you would recommend for people to go to?
Well, I personally have used a product from a company called Standard Process.
I'm familiar with that. Yeah. But what I wanted to say is that, in this today's day and age, even the food itself is not rich with the nutrients and vitamins as
Yes.
it used to be. So even when we go and we tell people, eat the real thing and all that, sometimes that is not enough also.
Right.
So like coming from the background of the Oriental medicine, is there like something that you do recommend to people on a regular basis as far as like
Well, I would say if someone just wants to support their system, they should get a food sourced multivitamin mineral.
right.
That's non-specific.
Right.
You
Okay.
know, if they have cramping, they might want to take calcium or
So, and you would refer
Is
them to that.
calcium, sorry, is calcium, because some people take calcium and it says it does the opposite effect on women, that it makes the bones so brittle that it actually not brittle, but it strengthens, it thickens the bones so it cracks. Is that a true statement?
I think we have a lot of problems with the osteoporosis because of all the dairy we eat. The countries and the populations that don't have a lot of dairy don't have a lot of osteoporosis.
Right.
So I think it's the type of calcium also. It's a type of calcium. You can have calcium carbonate, which is essentially carbon, you know, and your body doesn't. A lot of those vitamins, they contain elemental, but for instance, iron as an element. But we're not designed to absorb iron. You want to eat spinach that's high in iron, you know, so you don't.
How much spinach do we need to eat to get enough iron? In a mountain is
I mean,
No, you just, it's, you know, moderation in all things.
even in spinach.
Unless you're really a spinach junkie.
It's a good junkie to eat spinach.
So okay, so this you mentioned that one company that I'm familiar with. So if you recommend people that to take based on food supplement, that would be
Yeah. What? Look, standard process. There, I guess there are a couple places that the general public can buy it.
Capital Drugs.
Capital Drugs. Otherwise, they're not sold.
Right, they're not sold everywhere.
You have to get them. But if you get a food sourced supplement, that's what you want to look for. And a lot of the supplements, they'll say natural, but if you look at the panel on the side, one side is natural and the other side is chemicals, so they can say you're getting 100% of this, 500% of that. But that's not real. Like you're getting 100% of ascorbic acid, that doesn't mean you're getting 100% of your minimum daily requirement of vitamin C.
Right.
So food source is the key.
Also, another question that I know a lot of people, that people are curious about, the theory of after a certain age, as you get older, to start taking the aspirin that can prevent a heart attack.
Well, aspirin thins the blood.
Right. But they say it like a general thing. Like everyone that comes to a certain age,
healthy people take aspirin on a daily basis.
And if they, if they have bleeding problems or whatever, aspirin is. If aspirin were introduced today, it would be a prescription medication.
Oh, really?
Yeah. If it was introduced today, it would be prescription.
A lot of people are allergic to aspirin as well, and they don't even know.
Yeah, they know, but they ask you like before they give you, if you're allergic to. No, but it's like a statement thing that I'm sure I'm not the only one who heard about.
It's advertised on television. We watch television.
You get to a certain age,
right?
I think they recommend it actually from the age of 50 already. If I'm not mistaken.
And now there's some studies coming out that's saying that it's not necessarily that good, and it's an individual thing. Some people take aspirin and it really affects their digestion, their stomach.
Right. Yeah.
So
it's very acidic. Somebody has an acidic stomach. Yeah. It can cause a major damage, ulcer. It could really
the stomach is acidic anyway. But
stomach is acidic anyway. No, I don't know. Doctors today are confused.
And the other big thing is the probiotics. So what is your input on that? Like what do you think about how they recommend most people now to be on probiotic to help the gut?
I test for dysbiosis, which is the lack of the good bacteria.
Okay.
Not everybody needs probiotics.
Right.
Usually over time, it's not bad if you want to take a probiotic once or twice a week, but over time you get a die off of those good bacteria. overuse of antibiotics, long-term use
Right,
of other
so
medication, irregular eating habits, stress, riotous living. All these
Right.
things can wipe out the good bacteria. Then you
Yes.
start getting problems. So unless you have, I'll test people when I treat a condition, whatever the condition is. Basically, you want a good digestive function, and so I'll test to see whether a person has dysbiosis. In other words, requiring probiotics. But that doesn't mean they have to take it for the rest of their lives.
Right. Because that's another thing that they write everywhere. Probiotic is a must. This is a must.
Yeah.
It's
Well, when your doctor gives you antibiotics.
well, yeah,
okay,
that's
Definitely,
of
for sure.
course because it
But
kills the
even
good
then-
bacteria.
they say that it doesn't do anything. Like
Who says it doesn't do anything?
doctors, they say that the probiotics you cannot make it. You cannot.
If I had a heart attack, I would go to a medical doctor. But for nutritional information, I might not go to my medical doctor.
Yeah, I agree. I
Unfortunately, that they don't. They treat the symptom, like you said. It's more
They do what they do,
Right.
and it's what they do is important.
very
It
important.
doesn't
yeah.
mean that everything that they do is right for you.
Right.
The United States has it so that the unfortunate thing is that the AMA and they promoted doctors. The difference between a physician and God.
There's no difference.
No, God doesn't think he's a doctor.
The doctor think he is.
But
Yes.
but that's what they're trained to do, and
Yeah.
God forbid you need something, you hope you get the best one that does that.
Yeah.
But that's what they do.
And God
That's-
forbid you challenge them,
Yeah.
right?
So like I said, there are doctors that say, look, I don't know about it.
Right.
If it's helping you, fine.
Yeah, that's
So
a
what-
smart doctor.
So what was pushing you towards Oriental medicine? Because you didn't study it today. You could have studied Western medicine at the time that you went to study that. So why were you drawn to that? What was?
I was a teacher, and I wanted to. I don't know. I wanted something more, and so I tried business, and that was not that there's anything wrong with it. Wasn't fulfilling, and I was thinking of going into chiropractic, and around 30 years ago they had just legalized acupuncture, and so I started reading about that, and I thought that was, I read about it, and I said, this is pain control. This is great. I'll learn it. I could work for some orthopedist, but they weren't teaching pain control. They were teaching Chinese internal medicine. It was like studying Greek at first. It was like illogical from a Western medical perspective. It makes sense once you start using it. But that's the thing. I just wanted to get into something else. I started studying Chinese medicine, and
You fell in love.
yeah, listen,
Very interesting.
I tried to retire 2 years ago, and I can't.
You can't. You love what you do.
I don't think a doctor retires ever. I think once you're a healer, you don't have
Yeah.
the privilege to retire, because people are not getting, people are always, sick.
Yeah.
Sickness is always there. Do you have a lot of, you said you're retired now,
Well,
or you still
I
practice?
still see patients.
You still-
I just don't. I used to do workshops and seminars and stuff like that. I don't do a lot of outreach.
Okay.
Now it's-
Do you see children?
Yes.
Like what is the age, and what do you see them?
I've seen infants that were 4 months old.
Infants.
Yeah. I had this case where a 4-month-old baby had reflux. Every time.
Yeah, that's amazing. I heard that about baby, and I think
And so the
it's
doctors-
hysterical.
The doctors were giving him baby Benadryl, or whatever it is that they give them. And he was allergic to his mother's milk. We desensitized
How does
him
that
to
happen?
I've heard that. My friend
Is that
also
a
heard-
real thing? The baby can be allergic to mother's, maybe something that she ate. In that's.
I don't know, but he was reactive to her milk. And we desensitized him. And his reflux went away.
Wow.
So
What about thrush? Do you treat that as
thrush
well?
is
Thrush
yeast.
is
It's yeast. It's in the category of candida.
so babies get that,
Baby can get it from their parents, from their mother.
and that's treated how? Because probably the medicine treats it with antibiotics. No.
No, they treat it with actually what they're using now. I don't know if they use it on infants, but a drug called diflucan, which is pretty toxic. And again, it doesn't treat the underlying cause. It'll wipe out the thrush, but then it keeps coming back because the body's
Producing it.
environment is the same.
And it seems also that a lot of kids are developing skin asthma. That's a big thing. Like in the last few years, I mean,
Yeah.
the last probably, I would say 15, 16 years, I hear a lot
Allergies
about
and
that.
yeah.
The skin asthma for kids. And I saw some like really major
Do you think the
cases.
baby formulas today have something to do with children's developments?
I have no idea. I don't know. It's
It's an open
that's not
subject
my
here,
it's
right?
not my area.
It's an
of
open front
expertise.
there. We're gonna get to it. We're gonna get to the bottom of this because I do
Okay.
believe that formulas
Yeah, I mean, I think that mother's milk is the best, and I think they promote formulas, and they're like C-sections that are people do C-sections for convenience.
easy way out. Yeah.
Yeah, but some cases, some women,
Well, if
unfortunately, they can't breastfeed and they have to feed the children. So
Well,
it has
of
to be a
course.
formula,
Of course.
But if there is if there is the opportunity to do it, by all means, that will be the.
They were promoting formulas to the people in Africa, and it was very upscale thing. So they were not doing natural breastfeeding, and the babies were not as healthy.
Yeah, because over
Exactly.
there, especially, I mean, they would just. Yeah.
You get
Exactly.
immunity. You get your
That's a
immunity
control group
factors.
right there. You test.
Yeah.
It's absolutely from healthy to
Yeah.
put them in an unhealthy environment, and you're gonna have a result.
Well, we're
How
getting close to it.
interesting.
Yeah, it's very. Again, first of all, I want to mention again Dr. Katz email. So it's Dr.
It's
Katz
David Katz,
Katz, sorry.
OMD
OMD
@gmail.
at gmail.com. And this is if you want to get the list of the home remedies, or if you have other questions, or if you want to see him for consultation or whatever, that will be the way to
Kitchen
reach him.
home remedies.
Kitchen home remedies.
Kitchen home herbs.
Kitchen home herbs,
And-
definitely. I'm the first one on the list. You
Okay.
have already my email, so
I've got
you know
your
where
email.
to
I'll
send
send
it
you out the.
right away,
the
so I can
information.
talk about it because I like to give tips on the shows. We have a morning show that I like to give tips about nutrition, wealth, happiness, whatever is in the
Right.
wellness umbrella. So it's always good to know about some new things so you can add on. It was a pleasure to have you with us
Well, thank you for
and
inviting
to
me.
inform us with giving us all the information about this world of the Oriental medicine world. It's very interesting. It's
It
very
definitely,
close to me.
it's they say alternative medicine. It
Right.
isn't alternative. It might be classified as complementary medicine because everything has its place. And once people, like in Europe, homeopathy, acupuncture, it's considered equal to.
I like the name
to-
functional medicine. I really like that.
Yeah.
It's I think it covers everything.
But just
Basically.
on my I have one question that's like boiling in me. So the treatments that people can get through you or anyone who treats with Oriental medicine, are these people cured, or it's just their symptoms are elevated and they're maintaining a quality of life?
That depends. There's.
Depends on what on
I mean,
the
I've
situation.
cured people, and there's people that I've, not be able to cure, but they've gotten to a certain level where the symptoms are negligible. It depends on the individual. This is why I tell people that I start working with that if they're not willing to commit to 4 treatments, then don't waste their money, because I'm not going to necessarily get any results. But everybody is different and they respond differently. If I have to get results in 4 treatments. Not that I'm going to cure them, in 4 treatments, but there's got to be change.
Yeah.
But everybody is different, and how they respond is. I don't know how someone's going to respond after 4 treatments. I can give them a fairly realistic expectation of what it's going to take.
Excellent. Right. Okay.
All right.
Thank you very much
everyone,
for your
again.
valuable time
Thank
and
you.
being here
Yes.
with us. It was very interesting and informative. I feel so
Yeah.
much better
Get rid of the
by me
onions,
being
just
please.
by the osmosis here.
Yeah, get rid of the onions, please.
No, absolutely not. I'm the
Thank
onion
you,
girl.
everyone.
Many peels. Bye-bye.
Yeah.
Thank you for joining.
All right. Bye-bye.